Hi, I'm Dr. Michael Reiner, your host of the Independent Doctors of Pahrump, a TV show that airs Monday night on Channel 46. I want to remind you that I am a practicing physician in Pahrump, and I'm an independent practitioner, which means I am not bought by any insurance company or corporate medicine. We provide the highest level of care. We have nurse practitioners. We have other physicians, specialists who come to our office. Please come visit me. I'm at 1316 East Calvada here in the heart of Pahrump. Thank you. Okay, we're back for the last 15 minutes, and Ray brought up the interesting topic of addiction, and I know Ray spends a lot of time, or at least I don't know that for sure, but he seems to spend a fair amount of time down in the drug court because he brings that up pretty often. And certainly you can treat alcoholics with an abuse, or you might be able to get people with addictions to opioids on medications like Suboxone and other medications to help bring them down off the chemicals. But what drives the addiction? What drove them to those particular substances, and how might you break people from that? And really about the only thing that does really work substantially is the 12-step programs. And 12-step programs are basically can be used in just about anything else, because it teaches you how to get at the core of what the addiction is, and that is a selfishness, self-centeredness, and a lack of your understanding of the world and how things work. And you always want to blame somebody else for this, or you want to be a victim. Or maybe you might have been abused when you were a child. Maybe those things might have happened to you, and it left you feeling bad about yourself and worthless, and making poor decisions. But the criminality of drugs, I do believe that people that are dealing drugs should be punished, and people that are taking drugs should be dealt with in a different way. We have Richard on the phone. Richard.
Yeah, hi, Doc. How you doing?
Great. How are you doing tonight?
I'm doing great. Listen, I used to be a patient of yours, and then I went on Humana, and I believe that was the time that you weren't taking Humana. You were taking senior, whatever it's called. I can't remember now. But what kind of insurances do you take in case I wanted to come back? You understand what I'm saying?
No, go ahead. What was that now? I lost you a little bit there.
What kind of insurances do you take, Doctor?
Oh, we take everything except the Humana, that is Healthcare Partners. We take everything that is not Humana Healthcare Partners. Now, you have Humana out of Kentucky, which is the non-IPA part of it. If it's Humana Gold and on the back of your card says Kentucky, then we can see that also. But we do take any Sierra and Health and Life product. But I am not a Healthcare Partners doctor, and I avoid them like the plague. So. Yeah,
so I used to be a patient of yours a long time ago. Anyway, I wanted to come back and see you, but I don't think I have the right insurance.
Well, what insurance do you have?
Oh, I have Humana.
Okay.
But I don't know if it has Kentucky on the back of it. I guess I could look on my card. You say it's on the back?
Yeah, it'll say Humana, or if it's Humana, the IPA version, then it will list, it'll say Healthcare Partners IPA, and then it will list your primary care doctor. If it says Humana out of Kentucky, it'll just say Humana and Humana Gold, and then Kentucky will be where the claims are sent.
I don't see Kentucky on here anywhere.
Yeah, it will say healthcare partners. Well, you're kind of locked in we do offer a cheap cash price, but I mean, obviously, if you're paying for your health insurance, and I think Medicare rates are going up this year, you probably wouldn't want to be paying me and paying the government.
That's probably right.
But
Anyway, I thought the window was still open that I could change over to senior dimensions or something
yeah,
like that.
you might check. They've changed the rules on when you can switch and can't switch. So I believe if you have some type of illness and you want to switch to a different provider, I believe you can. But you're going to need to call, the senior dimensions people or the Medicare people, and they'll be the people who can help you with making that decision. Yeah, the open enrollment period, I think, closed December 7th, so you're right
Okay.
after the window. Yeah.
Okay, listen, one more question real
Yeah.
quick. I know you're located on Calvada, and I saw the address, but I'm trying to figure in my mind where that is. Whereabouts is that? Where are you next to?
Well, we are in this orange square building across from what used to be the Sears, and we're right across from Terrible's Roadhouse, and we're basically one block south of, one block west of Pahrump Valley Boulevard in Calvada on the right-hand side.
Is that the building that you used to be in, like back in 2001 or 2002?
No, those were a group of buildings, those long, thin buildings that ran across from the senior apartments. We're one block west of that, where they have the little karate place and that little shopping center, and then right over there was the American Bar, and then there's us.
Yeah, I remember the place. But you used to be in that place that you're in now a long time ago, didn't you?
Yes, I used to be at 1470 East Calvada, right across from the senior apartments, and that's where we built our first office and expanded, took up quite a bit of space, and so, yep.
Okay, well, I'll check into that, Doc, and I'll give you a call if I can do something about it.
Well, thank you very much. I appreciate the interest, and thank you for calling.
You're welcome. Bye-bye.
Bye-bye. And yeah, I didn't really spend much time on the open enrollment period this time. I think once healthcare partners got through buying all the practices that they wanted, they pretty much stopped all investing in their advertising, and I don't think they met their numbers, and so they reduced their billboards, and they did a bunch of other, they cut back on a lot of things, and I think Senior Dimensions was happy about that too. I mean, my God, the money that they spent to try and convince patients, and then that's true. If you go in to sign up for Humana in this town, they're going to direct you to healthcare partners. Humana likes healthcare partners because of the way that IPA works and the way the money is divvied up. And healthcare partners like Humana because they pay them big bonuses if they can manage their patient population well and keep them well. So this is what we've always known in medicine, which is there's strength in numbers and not everybody gets sick on the same day. So that's why insurance companies do what they do. And Obamacare is an absolute farce for insurance companies because it didn't make the insurance companies do anything except guarantee that you had insurance. And the way the insurance companies did it was they made very high deductibles because they knew they were going to have pre-existing conditions. So who can afford that crap? I mean, you're spending $470 a month for an $8,000 deductible. I mean, my God, that's $6,000 a year that you're paying, and then you still have to pay another $6 or $7 on top of that before anything comes out of your pocket. I mean, the insanity of this thing, and so when you look at your total cost and you say, well, that's about $14,000 a year that I'd have to spend. I know why people, form LLCs and corporations and employ themselves, and then they don't make any money and they go out and get Medicaid. I mean, but maybe that's what they wanted to do. They wanted to drive everybody to these government-based programs to make you more dependent on the system so that the system can squeeze you. And I think there are a lot of people that will say that any government big enough to give you everything you need is also big enough to take away everything you want. And so, you know, beware of the hand that feeds you. It can also turn around and slap you. So, you know, those people that are running and gravitating toward it. And of course, you know, doctors, I mean, we as physicians make up such a small dollars or whatever that is, but when you go to the pharmacy, look at what that bill is. I mean, you go to the hospital. I had a friend of mine who just had a bypass surgery, and the $265,000, $250,000 for bypass. I'm sorry. I mean, you know, it's that's just insane. Obviously, I could charge whatever I wanted, and the insurance companies and the government would only pay me what that's worth. But you know, in reality, you know, it's just it's out of control. I think a lot of things are out of control, and everybody knows it's out of control. And how do you break that system? It would be great if you didn't have insurance, and then everybody would be forced to pay cash, and you'd be amazed at what would happen to the healthcare industry. Prices would come tumbling down, but everything's built on this escalating, this system of, you know, we're going to charge more, so I'm going to charge you more because they're going to charge me more. And, you know, this inflation is running rampant, and who can keep up with it? And where does it all end? And I think it, like most people say, it ends in some ugly mess somewhere down the road, and we keep kicking the can down the road. But I'm not a financial advisor, but if I was, I would be basically trying to do everything I could not to subsidize or support the big banking industry in this country and in the world, because that, to me, is the root of all the evil. Because we don't make our own money anymore. We may print it, but the Federal Reserve System prints our money, and there's nothing federal about the Federal Reserve. And if you don't know that, let me give you a brief lesson in economics in the last minute I have here. Our government does not own our money. The Federal Reserve System does. And look at your dollar bill, except all the ones from the 5, 10, 20, and the 100, and it has this nice black seal on it, and it says Federal Reserve System Note, meaning it's based on nothing. I mean, it's based on absolutely zero. The only thing that may have any value, if at all, is a dollar bill, the single dollar bill, which still has a little seal of the U.S. Federal Reserve Bank it's drawn on, but nothing else is. And so if that doesn't tell you the sad state of our monetary affairs, nothing else will. And you'd be best to try and not deal in credit, because that's a bad tax on everybody. But I'll tell you what, I could probably go on for, I digress a lot with some patients when we get into monetary things, but one of those things I do believe is that our money system is absolutely worthless, and we'll look at, you know, someone said earlier, I said earlier about obesity tied to consumption, and the only reason the world's economy exists is because the U.S. is out there consuming everything out there. So I'll leave you with that thought, and hopefully we'll be back next Monday night. Until then, stay well, stay warm.